The Government of Uganda, through the Ministry of Health, together with Africa's Centre for Disease Control and Prevention and the World Health Organization (WHO), have called on countries that continue to impose travel restrictions on Uganda to lift them. The three organizations say the restrictions are not supported by scientific evidence and should be reconsidered.
Mainly health workers, doctors, health workers who have been managing Ebola in Africa, and they get infected, they are evacuated for treatment. So meaning that there is no serious risk and threat of transmission through commercial flights and moving all over the world. That's the evidence. So that means for the US, Canada, UAE to put travel restrictions, that decision is not backed by science from those figures.
Travel restrictions and border closures have got no scientific backing that they're effective in controlling outbreaks.
I sent a letter to the US to request them to stop travel restriction to Uganda because this letter is public. Because we believe that it's not time for punishment when countries are applying transparency. Why the US didn't apply travel restriction to France?
Although Uganda officially declared the end of its Ebola outbreak, the Minister of Health, Dr. Chris Baryomonsi, has cautioned the public against becoming complacent. He says Ugandans should remain vigilant because the neighboring Democratic Republic of Congo continues to battle an active Ebola outbreak.
But as we announced that, we also gave words of caution that in Uganda we must remain alert because on the other side of DRC, the outbreak is still very active. And earlier on, we had signed a memorandum of understanding between Uganda and DRC, where we are handling this outbreak jointly.
According to WHO Regional Director, the continent should not be subjected to double standards.
What is WHO advocating? And you can retrieve all the tweets of Dr. Tedros, always complaining and advising countries, especially on the northern globe, not to give travel restrictions.
We don't need double standards. And as an African leader, I clearly say that no double standards.
Meanwhile, the country director of the Africa Centre for Disease Control and Prevention commended the government of Uganda for its swift response and commitment to successfully containing the outbreak.
This outbreak was in Kampala. It means in the capital of Uganda. If it was not well controlled, we would not sit here today speaking. We need to say we are so proud to see Uganda playing that role and demonstrating to the world that we can manage an outbreak of this magnitude.
The time it became declared in DRC, there was a lapse of 3 months. So we are chasing the virus.
Uganda and Democratic Republic of Congo declared their respective Ebola outbreaks on 15th May 2026. While Uganda has since been declared Ebola-free, the Democratic Republic of Congo continues to record new infections. According to health officials, the DRC has registered nearly 4,000 confirmed Ebola cases and close to 1,000 deaths this year, underscoring the need for heightened vigilance across the region. Officials said the continued movement of people across the shared border calls for strengthened surveillance and sustained public awareness. They are urging the public to remain vigilant, observe recommended public health measures, and promptly report any suspected Ebola symptoms to the nearest health facility. Nagujja Serena for NSTV.